Module 5. In this module, we examined how humanitarian organizations can develop strategies and approaches to facilitate the inclusion of older people in participatory roles in program development. The module looks beyond the important consideration of how to ensure programs and services are inclusive of older people with and without disability as users and beneficiaries of the programs. Rather, the challenge addressed in this module is how to bring older people into the center of humanitarian responses by including them as active and influential participants in decision-making process across all stages of the humanitarian program cycle. Inclusive programs for older people with and without disability are essential for humanitarian organizations to develop. A protection mainstreaming principle that promote meaningful access, safety, and dignity for all affected population in the delivery of humanitarian aid to provide a framework for humanitarian programming. The Humanitarian Inclusion Standard is an important resource and tool available to organizations to help guide the development of inclusive programs and services. However, in addition to the importance of program inclusivity, humanitarian actors must also involve older people beyond the initial assessment that are undertaken to determine needs and vulnerabilities of a group of people affected by humanitarian crisis. It is the involvement of older people in active roles that contribute to positive change and influence on program development across all stages of the humanitarian program cycle. It is necessary to also recognize that older people have the choice and may prefer to participate in a passive roles. Barriers to including older people as a participant in program design, such as limited time to adapt organizational process to be more inclusive of older participants, or limited access to older people who are willing and able to actively engage in program development, must be addressed by the organization to effectively integrate older people in this way. As highlighted in this module, there are many ways that older people can be included in each step of the program cycle, from the initial needs assessment to strategic planning to implementation and monitoring and to program evaluation and sustainability. To remind you of a few examples, older people can be involved as a focus group leaders when identifying barriers of older refugees, involved and trained to be part of assessment team during the assessment phase, involved in developing the program objective during the planning and design phase, or involved as a peer evaluator of early findings during program monitoring. There are challenges that organizations need to attend to when including older people as active participants in program development that may require budgeting of funds and time. Perhaps accessibility of office building will need to be addressed to ensure that older participants can physically join meetings. Transportation may need to be organized to ensure that older people are able to get to necessary location to do their task. Organization staff will also need to be trained to support older participants in their roles as the programs are developed and monitored. Effort will need to be undertaken by the organization to recruit older people to be involved in these roles, and varied communication approaches will be required to locate interested participants, especially as older people may be hard to reach or hidden because of disability or language barrier. For example, older people have the right to be included not only as beneficiary of a design program, but also as active participant in the development of a humanitarian response program. To ensure accountability, relevance, and the quality of a humanitarian response, older people with and without disability must be involved in an active participatory ways across all stages of the program development cycle.